Dude, remember those good old days when we were just recording on my couch?
Yeah, the couch was comfortable, but there's just something about two guys on a couch together that's not, it doesn't get you like, you don't feel like you're getting informed, really.
That is true.
It's kind of like, what, are they trying to get me to do something? Like, what's the goal of this?
I do remember, like, you had a lot of your clients give us feedback on those episodes on my couch.
Yeah.
And they would always say something like, oh, there's nothing more interesting than seeing two guys on a couch talk about the gym.
Yeah, like super sarcastic.
I know, I'm like, oh, dude. I mean, we're still on couches right now.
Yeah. We had the live, laugh, love sign behind us.
Oh, yeah, that's right.
It was. Yeah.
And those little small plants also.
Yeah, but now we've upgraded. Now we have the professional podcast studio.
Oh, yeah.
Shout out to Cal Homeco and his Polical. Exactly. But, let's jump into the episode, Brandon. This is a great topic today. This is all about pain and living with pain, right? We're specifically talking about more chronic pain in this episode.
And we're talking about how it's very unique and it's all about the individual, especially when like someone tries to explain to you like, oh, my pain feels like this, that's why I'm feeling lethargic. I'm pretty sure you've had like clients or you yourself totally. Something like that. So this episode is all about like, why are people feeling a different kind of pain? Why is their experience different than someone else's?
And today we're going to be looking at pain in a certain lens, right? So it's the biopsychosocial model. Yeah. So why don't you tell the audience a little bit about what that model is?
Yeah, so before we get started with that, I just want to say that we're talking about more chronic pain and not acute pain. So acute pain is more of something like, let's say you sprain your ankle and that initial pain you get like 24 hours after, that's more acute pain.
Or acute pain's like the other week, my smoke alarm goes off while I'm in the shower because my fucking apartment is so small that like it just, when I'm cooking something, smoke alarm always goes out. So I get out of my shower to go deal with the smoke alarm, slip on the wet floor.
Oh, you actually slipped?
Slam on my back, and that was acute pain because something caused it. It was there for, maybe a day, a couple of days, maybe a week, but it's not something that I live with every day for... that it's just my normal life. Exactly. I knew that it was going to progressively heal and get better and better over the next couple days.
Exactly. And that was a great example of acute pain. So more chronic pain is what we're talking about here when we talk about pain. Chronic pain more of like, for example, me. I've had a herniated disc since probably 2015, 2016 from trying to squat 4 plates. I did hit it, by the way, twice.
My man.
2016. But after that, I did feel that sharp radiating pain going down my leg. And ever since then, I knew my back wasn't the same. I mean, it's been like 6 years. So right now, I still feel it flare up sometimes. Yeah. I still have to keep up with my mobility drills, still have to strengthen my weaknesses.
And I'm the same. I had a back injury where I think they said it was a partial herniation. But I had the same thing, radiating pain down my left leg from, a nerve being impacted. And it was something that at the time was like really, really like, it just really messed with me. I was so worried that I would never be the same. I would never be able to lift weights or do these activities I enjoyed. But, becoming more educated about the pain really empowered me because now I still have flare-ups every once in a while, but I know, I can identify why that flare-up occurred. I know what I need to do in order to diminish that, to deal with it, and just to make sure that these flare-ups happen much less often. So it's kind of now when pain flares up, I perceive it much differently. And it's a lot more empowering. It's not something that I am feeling like, oh, my life is just going downhill. My body's degrading,
Yeah, exactly. And that's pretty good that you're aware of like what those flare-ups mean. Because there's actually 2 famous stories of about 2 different construction workers that I'm going to talk about right now. And it kind of shows why someone's pain feels different than the other. So you may have heard the story before. So we have one construction worker. He's going about his day, about to do a project. He's walking around, trying to maneuver around areas, and then he sees a bunch of nails on the floor. So he's in a rush. He's trying to get this project in, so he does his best to maneuver around the nails. Yeah. But he actually steps on a nail, and he saw him step on that nail. Ooh. And he saw that nail go through his boot. So he was like, "Ah, shit! Someone call the ER." He was in pain. Yeah. Screaming, crying. Everyone was like, "Holy shit!" It looked like it was pierced super deep. So they called the ER. They called the ambulance. He's in the emergency room, and then the doctor. Mind you, the guy's still screaming. The doctor's like, okay, let's see how deep the wound is. Because any doctor wants to be like, okay, let's see how deep this wound is before we treat it or whatever. So they take off his boot, and the nail didn't even pierce his skin.
No, I knew it.
Have you heard this before?
No, but I was just like guessing as you
Yeah,
were.
so
Like,
the nail didn't pierce his skin at all. So it shows that like how someone can perceive like just that act, and maybe like one of his friends told him, maybe he had like a coworker like saying like, oh, I got an infection because I stepped on a nail.
Yeah.
Maybe that kind of influenced why he was screaming in pain.
If he didn't see him step on it, he literally wouldn't have felt anything probably.
Exactly.
Wow, that's incredible.
So let me bring you to the second case study. So the second guy, construction worker, he's more in the room with a nail gun. So he's doing whatever project he is. He's nailing. I don't know. I'm not familiar with construction. Nailing, whatever.
You know what a nail is?
Oh, I know what that is. So he's using his nail gun, and then out of nowhere, he was just such in a rush to get this project done that the nail gun hits him on the head. All right, but then he didn't really think of it. He just thought like, oh shit, something just hit me on the head. Let me wipe it off or whatever.
Sure.
So he just goes about his project, tries to get his deadline in. All right, he goes about his day, and for the next 5-6 days,
No.
he actually had a dental appointment. All right, so he was pretty normal. All right, he had a dental appointment. All right, because of a tooth pain. I don't know if it's related to the nail incident or whatever, but at the dentist, they actually took an X-ray of his head, and they found out that a nail actually was launched into his, I think, cerebral cortex or somewhere in there. I'm not too sure about the specific landmark or anatomy, but it was in a very important brain area. And they were surprised that he was still walking and moving. So that's just another story of how someone else's experience in pain kind of changed how they feel at the moment. Compared to the first construction worker, he just saw himself step on a nail. He's screaming out of nowhere.
Zero injury.
Exactly.
In anguish.
And then the second guy, he got a nail gun to the head. He thought it was just nothing. He thought it was just like a little brush it off, kind of go about your day type of thing. And then he found out, oh shit, there's actually something in your actual skull.
That's incredible.
That's a pretty crazy case study, huh?
Yeah.
We'll try to find those reference links for the people back home.
Definitely, yeah. We'll put a link in the show notes. But that just shows how powerful our minds can really be. And obviously your psychology is something that is going to impact how you perceive pain. But there's many different factors in this model that we're talking about. So why don't you intro that first factor in the biopsychosocial model? Yeah,
so biopsychosocial model, we're going to talk about the biological factor first, which pretty much means how anything biology related can affect your experience of pain. So this could mean something like a medical diagnosis you get from your doctor. It could mean like an MRI or X-ray or whatever imaging you see. Or it could also even mean your current health condition, your current movement pattern, or even how you physically feel at the time of the pain. Yeah. So a big one is actually the diagnosis, because when someone gets a diagnosis from their doctor, they give them like an official diagnosis, and people use other past experiences, which we'll get into later on, about how like, oh, I got a herniated disc, for example. That means my spine is fragile.
Well, that's what I thought.
Yeah.
I had been experiencing this pain and for like a week or whatever, and just not really thinking too much into it, just knowing something's wrong with my back. And then I saw an X-ray, and they pointed out, they said, okay, so you have a partial herniation. And they didn't really explain what it meant to me, right? They could have said, this is what a herniation is, this is what it can be, this is what it might be. They didn't tell me any of that. So I just heard the word herniation, and the first thing I thought was spine surgery, because I just knew somebody who had spine surgery because they had a herniation. And that sounded really serious to me. So then I started indexing my injury as, oh, my injury is gravely serious. This is an injury that could be life-changing. This is something where I might never be the same. But if somebody had educated me and communicated it differently, maybe I wouldn't have perceived it that way, and the whole course of my injury could have been shifted.
Exactly. Like when you have a herniated disc, like that diagnosis doesn't define who you are. It's not like someone with a herniated disc will experience the same symptoms, go down the same journey as like you're going to. Yeah. So that's a big thing that a lot of people like kind of they're not really informed once they once they get a diagnosis, especially from like someone who has a high authority, like a doctor. They're like, oh shit, I guess this is how my life's gonna be.
And there's that kind of classic trope of like a doctor telling a patient, you're never gonna walk again after they get into, or you're never going to lift weights again.
Exactly.
They'll always say you'll never do X again. And I remember when I was really young, I used to think like, wow, that's so incredible. Like the doctor told them they wouldn't do this, and they did end up doing it. That's like amazing. But then you start to realize these doctors are flawed human beings who like sure, they have a high level of knowledge, but oftentimes they're just kind of operating off of, they're trying to be the utmost safe in this situation, where they might say, okay, well, in this person's current state, they shouldn't lift weights again. I'm just going to tell them, never lift weights again. But realistically, we can recover from these injuries and oftentimes get back to where we were or even exceed our levels before it. So there's just these self-limiting or these limiting beliefs that professionals put on people, it's always coming out of a good place, but sometimes it can be hazardous.
Exactly. And I mean, there's like a very famous study, it's actually going on Instagram right now, where they took a spine of two different 70-year-olds.
Yeah.
One who's like an Olympic athlete or triathlon person, and the other person who's like more sedentary. It shows that both of their spine, they both have herniated disc.
Yeah.
But it shows that the person who was more like active, the triathlon athlete, was actually asymptomatic compared to the person who was sedentary. So it shows how it's very important to kind of keep moving as you age.
Yeah. So that's that biological condition, right? Where somebody could have the same injury as another person, but that doesn't mean all injuries are going to be expressed the same way.
Exactly. Yep.
Well, the next portion of the biopsychosocial model of pain, or is it biosocial psycho?
Biopsychosocial.
Well, we're going social.
Yeah, social's
for the
next.
second one. And yeah, the social aspect of injuries is something that, is really going to impact your pain as well. Why don't you talk a little bit about that, Brandon?
Yeah, so for the social aspect, this means social as in your family or friends had the injury that you have.
Yep.
And then they're telling you their experience. So once you're exposed to that, especially as a kid, you'll be like, oh shit, my mom had this growing up, or my neighbor, close friend or whatever had this. So I think that their same injury, their herniated disc, is going to be similar to how my herniated disc is. And that's just not the case, because you don't know what the stress level that those people were going through. You don't have the same stress level as them. You don't have the same lifestyle as them. You don't have the same conditioning level or even mobility. Like even if they weren't active, they might be more mobile just from their lifestyle and their ankles or their spine or whatever. So they all have like different unique limitations compared to you right now. So that's a very hard one that I do get a lot of clients come to me, and most of my frequently asked questions are usually about like, oh, my mom tried this for her back, or my dad tried this for his shoulder. You think it will be okay for me? So I kind of have to explain to them how, hey, everyone's different, and it really depends on your current state as well.
Totally, and it's just not useful to think that your injury is going to mimic, your mother, your aunt, that random neighbor you used to see limping around growing up, because like you said, everyone's different, and it's not going to be helpful if you go into this recovery process just thinking that the rest of your life is going to be limping around like your mom was.
Exactly.
Like, she herniated a disc, she walks with a cane now, that's going to be me.
Yeah.
That's not true, and that's not a resourceful way to look at it.
Yeah, like I do have a client right now where she actually injured her back, and I'm seeing her for lower back pain rehab. She was telling me how her mom injured her back a few years ago as well.
Wow. And
her mom was very active, but then she stopped weightlifting. So she actually came to me because she wanted to do more slow weightlifting and quote unquote not lifting too heavy. So once I actually built her to a point where she was lifting heavy, I told her, hey, remember our first day you told me that you didn't want to lift heavy weights because that's how your mom messed up her back, I guess.
Yeah.
The doctor told your mom that. And she's like, oh yeah, I guess not anymore. And I had to explain this whole model to her. So
yeah,
it's very eye-opening when you explain it to people.
The first time I heard about this, it was interesting for me because I had never really heard it presented this way before. But then I could immediately look back on my injury and realize, wow, I was experiencing, everything that this model talks about. And that's kind of what we're going to lead into next is the psychological component of it. Because that's something that when I hurt my back, profoundly impacted me. I look back and 80% of my injury was psychological in how I now perceive it. So we'll talk about that in a moment. But as far as the psychological models go, fear it's valid and it's okay to experience when you have an injury, but your fear can then become permanent beliefs, and that's not resourceful.
And that's when it becomes a problem, because once let's say like you injure your hip, or you feel a hip twinge when you're working out or whatever, some people will start thinking of like, oh, my hip just got injured, so let me go ahead and relate back to what I heard from when my parents injured their hip, or they'll even search online and be like, what can I do with like a strained hip?
The WebMD warriors.
Exactly, and that actually leads them down, especially if they're not informed as well, that leads them down to like a very dark like hole, to where it's like, oh shit, I'm going to start thinking of the worst. And that's a component called catastrophizing.
Well, that's what happened to me with my injury. So at first, I had this injury. Looking back, I was just really sedentary for a period. And then I jumped into a high period of lots of, mountain biking, lifting, all these things. So my body just wasn't prepared, and I had a little lower back injury. Fine, whatever. But then I saw the x-ray that I had the partial herniation. They communicated that to me, and it really impacted how I saw things. So already, because of just not much going on in my life at the time, being on a break from school, the injury, and not being able to see a physical therapist right away because my insurance was being weird, I had just been sitting in my house all day. So already I'm not feeling really great, a little depressed, I think. And once I heard that, I just kind of went down the spiral where I was like, oh my gosh, okay, so the pain I'm experiencing is serious. And this really led down this whole journey where I finally went to physical therapy, and we dealt with the pain. But even after I recovered and they told me, you're ready to go back to work, you're good again. I didn't feel ready to go back to work because I just felt like I was so fragile. I perceived it as, because of this injury, my body is degrading. I'm never going to be the same. And it like really, really messed me up. Like I barely left my room for like 2.5 months. This was one of the worst periods of my whole life because I felt like, oh, I'm in so much pain. Like I just can't do much right now. And I realized looking back, like even after I got cleared from physical therapy, I would wake up in the middle of the night with just like back pain. And I remember going back to the physical therapist, and she's like, your assessments are all looking good. Like your function looks normal. But I just had these random seizures that would wake me up in the middle of the night. Looking back, I realized that was psychosomatic. Like that was just, a combination of all this emotional turmoil that I was experiencing, initially just related to this injury, but now it was so much more than that. That was impacting my body physically. So looking back, I'm like, wow, like I just didn't understand that, but it wasn't just my lower back, right? There were so many other factors at play.
Like, especially like, I'm pretty sure when that happened, like other stuff started flaring up, like maybe neck or even hip, because that's usually what happens with a lot of clients when they do get like some kind of a flare up in their lower back and they start thinking those negative thoughts. Then other parts in their body start like seizing up as well, like their neck, especially like the close joints, like the mid back, the hip.
Yeah, what was I think it was like my quadratus
lumborum. Yeah, that's a very common muscle to seize up, especially after a lower back injury. But yeah, that's actually a really great story when we talk about catastrophizing, because I have a lot of clients that really go down that rabbit hole where they're like, let's say they feel a little pain in their lower back when we deadlift. So then they'll be thinking like, oh shit, I have pain in my back.
Like, and wait till tonight, it's gonna get even worse, or whatever.
And then they start thinking like, I have pain in my back, I can't bend over anymore. Oh no, I can't work out at the gym, my health's gonna decline. Oh no, I won't be able to travel or go play with my kids, walk my dog. Oh no, and then it'll go to a point to where it's like, oh, I won't be able to work because I won't be able to move, and then I won't be able to support my family, and then my family leaves me. They literally go down that rabbit hole, because of that, those negative beliefs of how that injury is gonna lead them to like the worst situation ever.
Yeah, I just remember during that period, it was like just such a dark period for me. I remember thinking like, I was just depressed at that point. I remember thinking like, things will probably get better, but like I can't see how they will. Because I was just so consumed with this injury. I was walking around, and like you said, whenever I'd bend over, I would like think all about how I was going to do it. I would remember I'd brace my core, bend at the knees, hinge perfectly, and people would be like, yo, like, what are you doing? Because it just looked weird, right? I'm like, drop a pencil, and I'm like, doing like a deadlift, and I was just so worried about re-injuring my back. I would just constantly think about like how I was moving and my body, and it just was not a good place to be in.
Yeah, and then that's actually a good example of a fear avoidance behavior, which is what a lot of people go through after some kind of injury. So they'll avoid a certain movement for lower back pain. Like there's some people who would like, when they would pick stuff up, they would have to do a perfect hinge, or like even to like drink from a water fountain, they'll do a perfect hinge.
That was me.
Yep. To tie their shoes after going on one knee, what they would do is they'd either perfect hinge up, or they'll do a perfect squat, or use their hands to help them bring their
I would do a lunge.
A lunge,
I would do like a perfect lunge, and then like kind of hinge forward and tie it.
Exactly, and that's fine. I would say that's fine, especially for the first like 24 to 48 hours.
When you're actually in that pain.
Of that injury. But if you keep doing that for like, let's say, a week or even months straight, your body starts to like kind of forget how to actually bend the spine like that. And you don't want your body to forget that, because the body's meant to be to move in all planes and all degrees of motion. So once you kind of just stop doing that bending over and tying your shoes, the body's just going to say, okay, hey, we're not going to do that. We're not going to be bending over anymore. All right, we'll just keep it with the hinge. Let's not focus on using those muscles that help you bend over then. So when you go try to bend over to tie your shoes, after like months of just hinging, that's when you start feeling that seize up of your lower back, because you're like, oh shit. Your body's like, oh shit, I thought, I didn't know we were doing that anymore. So that's why all the muscles seize up.
And it's not realistic to never round your back again. That's something that I've realized more recently is, okay, I've had a lot of progress in how I've kind of bulletproofed myself and become more resilient in that area. But, I was doing a deadlift and I tweaked my back a little bit. And my form, if you watched the video, kind of looked perfect. Yeah. But what I realized is there was just a subtle amount of spinal flexion, which for me, because I just really don't condition that movement, my body was like, whoa!
Exactly.
What's going on, right?
Yeah.
So after the injury, when I finally started approaching it better, one thing I did, which I look back and I'm like, I did that very well, is I started reincorporating movements and kind of slowly building up. So first I was like, all right, let me do some light kettlebell swings. Then from the light kettlebell swings, it was heavier kettlebell swings. Yeah. Now I felt comfortable maybe doing like deadlift again, but maybe more elevated, or a trap bar. And I slowly built up to more demanding tasks. Exactly. So not only did that work physically, but mentally it allowed me to go, okay, I'm checking all the boxes. I'm taking it one step at a time. And that was really helpful.
Yeah, that's very helpful, especially because for the common person, if they have pain in their back from a deadlift, they would totally just avoid deadlifts, period, instead of just like gradually progressing into it, which is what you did there. So also another important factor is also training your spine to bend. So that's why there's an exercise like Jefferson curls, where you're just bending with your spine. You're pretty much doing a deadlift the way you're not supposed to. But you do it lightweight, of course. You've definitely seen me do it.
I've seen you do it, and it's something that I plan on doing myself because I've realized like this is still an area of weakness for me, is that flexion in the lower back. So I need to make my body more resilient.
Exactly, yeah. So a lot of people do have to incorporate that. Even me, I try to hit the Jefferson curl at least like once or twice a week. Yeah. Just to like make sure that like my back is stable in that motion.
So for somebody who is living in this chronic pain, is that something where they should just jump right into doing Jefferson curls, or are there ways where you should probably address other things or check certain boxes before you start doing something?
Yeah, I would say definitely do not start doing Jefferson curls, especially if you're having chronic.
With like 225, just like And for everyone listening, a Jefferson curl is essentially you're doing like a deadlift off of an elevated surface, but you're intentionally rounding your whole spine a ton. And
you're literally lifting with your spine.
You're lifting with that, spine, the lower back usually.
Yeah, I mean, I will say it really depends also, especially if like if you know what the root cause of your back pain is, then Jefferson curl might be good for you. But if you're someone who are like, I don't give it to people if like they're in a big flare up to where it's like they re-injured their back and then it's just like really bothering them. I wouldn't give it to them. I'd give it to someone after they get it over that flare up and then train them slowly into it.
Yeah, so that's why really with any pain, obviously we're talking about the right ways to approach it through this biopsychosocial model. But when you're seeking out a practitioner or a provider to take care of your injury, a physical therapist, what are some things they should look for or ask, or what's the sign that the physical therapist is going to help you approach that injury in the right way? Because I can look back and I know that the physical therapist I went to did not address any of those psychological or social elements. Sure, they strengthened my core, they strengthened the surrounding muscles, which definitely helped.
Yeah.
But I wasn't educated in these things, and if I was, the trajectory of my injury experience would have been vastly different.
Yeah. Well, the first thing I would do is first up, straight up, set the expectations high, as in tell them what they're going to expect with rehab and even with the injury.
Yeah.
So I'll give you the example of what I tell post-operational patients, like after surgery. After surgery, people have pain everywhere they can think of. That's all they'll complain about in all of our sessions.
Yeah.
And the first thing I tell them the first day is, hey, so right now, they're seeing me like a week after or a few days after. I'm like, right now, you probably don't have that much pain right now just because there's a nerve block. But when you do have that pain, I'll tell you right now, you're going to feel it everywhere. And I'll tell you why. It's because the nerve block, it kind of senses your perception of pain. And those nerves are all over your muscles and skin. With surgery, the surgeon has to cut through the skin, move the muscles around, or even kind of take a small muscle away, which is a graft, and put it into repair a muscle. So we're pretty much moving a bunch of nerves everywhere. All right, so after that, the surgeon sews you back up, puts everything where it's back together. So when you feel that sensation of pain, if you're feeling it right now or a few days after, a few weeks later, I want you to think of that pain I want you to tell yourself when you feel that pain, hey, my body's actually healing because I feel that pain. Instead of thinking, oh shit, there's a lot of pain right now, I shouldn't have gotten to surgery. Fuck, my life sucks.
Yeah.
It should be like, oh, I could finally feel my nerves because I'm feeling pain. So that means my body's properly healing and it's on the right track to rehab.
It's just a part of the process. They're not broken or abnormal or...
Yeah, so I changed their mindset like that and kind of reframe how they perceive pain. They'll perceive pain instead of them just like thinking, oh, pain, this sucks, I don't want to do my exercises. They'll be thinking of it oh my God, I'm able to now feel the sensation in my thigh. It hurts, but I'm healing.
Yeah.
So that's one way I tell my post-operational clients or patients. And the second one, when I tell more of my clients with the chronic pain, I tell them, hey, the body is like pulleys and levers pretty much. So you feel that pain in your back because there's either something not pulling or being stable efficiently. So we want to address that. So your body feels that pain because it's sending a signal to your brain saying, hey, the pulley and lever, it's not efficient. So let's go ahead and focus on stabilizing or mobilizing some of those areas around the lower back. So it's pretty common if you either stabilize or mobilize the joints around the lower back, like the hip and mid back. And once you do that, it'll actually help the person perceive less pain because that pulley or lever is not pushing on that lower back area essentially.
And for those areas of strengthening, typically is that going to be like the deep core muscles, TVA, your lower back muscles themselves?
Yeah.
Like it would be like the multifidus?
It would be multifidus. It would be the core. It would also be
glute med, side of the hips.
It would also be the lats. Also, the lats are a big one because the lats. A lot of people think the lats are like only like upper back, mid back, but they actually connect to a fascia, the thoracolumbar fascia, that goes lats all the way down to the spinal column, down to where your SI joint is, or the posterior pelvis area.
Yeah.
So a lot of people really neglect that when they rehab their back. That's why I also add pharmacaries to a lot of people for that lower back rehab. But yeah, that's one way of like setting expectations for my patients or my clients that I see with pain. I tell them the first day of like what they're going to expect, just because if I don't set that expectation, they're going to not exercise even because of a flare-up. Even though I tell them, hey, it's good for you, do this exercise. Because I give them home programs.
Totally.
Yeah, and then once they feel pain, they're going to tell me like, oh yeah, I stopped doing the exercise because it was painful. I'm like, oh shit, that just killed our program.
Yeah, like now we got to restart this.
I know, right? Yeah.
Come on, dude. Yeah, well, that's so great that you do that. And I think that even if somebody maybe is forced to go to a certain provider through their insurance that isn't operating out of this model, maybe they have like an older physical therapist who's kind of that old school physical therapy.
Yeah.
Well, this is still something that you can self-educate on, right? You can still be aware of these things so that, they'll be taking you through that physical aspect of it, but you can still think all these things to yourself as you go through the process. Okay, pain's a little worse today. Does that mean all hope is lost? I'm never going to be pain-free? No. Setbacks are a normal part of the healing process.
Exactly.
You can reframe all this, and it's just so empowering. Like, now when I have lower back pain, I don't think, oh, my body is deteriorating.
Yeah.
It's never going to be the same. I think to myself, my body is resilient, and this is a normal part of human existence as an active individual. And, you know, pain is just my body telling me that I need to address some things. So it's really empowering. It's really just changed my life drastically.
Yeah, it's even like a good mind shift change, especially because like there's a lot of people that say, don't look at failure as like you totally wasted your time. Look at failure as like a lesson. Same as pain. Like if you feel like pain in your knee when you're squatting, think of it as like a lesson to where it's like, okay, you want to ask yourself, why do I have pain in my knee?
Yeah.
Could it be ankle? Could it be the hip? Or maybe record yourself, do the squat again, and see if you have pain there. You can watch your whole form. So you really want to like more learn about your body when you have the pain.
And then it almost becomes exciting to a degree. I know a lot of people who they get that knee pain. They think, okay, how can I mask that knee pain? Do I need a knee wrap? Do I just quit squatting altogether and only do a hack squat machine? But I've had clients who they start to experience a little knee pain, and I go, okay, it seems to me that your ankle mobility is lacking. Let's improve that, reduce the weight for a little bit, and see if your knee pain goes away. They improve the ankle mobility, knee pain goes away. Now we're squatting, and we're actually surpassing the most weight they've done before because we address these imbalances. Now they're actually building more muscle, getting stronger, feeling no pain, all because they took a step back and they didn't just ignore this until it kicked them in the face.
Exactly, yeah. And that's like a lot of the clients I see, especially like in their like 40s. Like they're those clients that would tell me like, oh yeah, I've been dealing with my shoulder pain since I was like 16, 18, 21, but haven't gotten really checked. And then now they're having pain to where it's like they can't even like what's called shampoo their hair or stuff like that. Yeah, or they can't do it for a long time or else their arm gets numb.
The last thing I'll say about pain though is it's really with anything, if the pain is not significant enough, it can be really easy to kind of ignore it or push it to the side. People make life changes out of pain. When the just being how you are, your current state is so painful, that's when people typically go, all right, now I have to reach out to a physical therapist.
Exactly.
But that really is not proactive. It's going to be so much better for you if you say, okay, I'm noticing some glimmers of pain here. I don't really want to let this persist for years until I'm eventually much worse off. Let me just take care of this now. And it's so much more empowering. It's just all around a much better thing to do. Yeah. So guys, if you're experiencing any pain, you got an expert right here. Not only can you reach out to him, but I heard that actually you're going to be releasing some pain programs that actually people can self-assess to a degree and perform on their own at home.
Yep.
And I know that I just went through your shoulder program where it, obviously for me, you did tailor it a little more specifically, but this is something that, people who are experiencing pain can just go through these exercises on their own and really help their body heal. So why don't you talk about those programs a bit?
So it's in the works right now, but I'm planning on having like a general assessment for the person once they start the program. It'll be an assessment on their own. They'll take a video of themselves and compare it to the model that I'll have. It's probably gonna be me, but me doing the assessment of what you're lacking. It'll tell you what you're lacking, what your weaknesses are, and what you need to work on. So let's say for shoulder pain, let's say you're lacking on lat mobility. It'll take you down a route to where it'll say, okay, to work on lat mobility, you have to do these exercises. And
then if this exercise is hurting, maybe don't start with this, do this first. Yeah. Progress to that. So it's going to be totally comprehensive.
It should be easy to where it's like, all right, this exercise is too hard for me, but there are other options I can see while looking at the whole program.
So guys, whenever those are available, we'll make sure to put all those programs down in the link in the description so you can have access to those, because it's so empowering to be able to address your pain and not have it anymore.
Exactly. And I'm gonna say one more thing, just because I do get a lot of clients that just like always complain about their pain, and they always bring up one reason, and the number one reason that I actually see is that, when I was younger I was able to shake it off, or when I was younger, when I was in my 20s, I was able to still hike even when I flared up my knee or flared up my lower back. But hey, you're not gonna be young forever. I'll tell you right now. When you're in your 30s, 40s, I'm not 30 yet, but from what people tell me, that those injuries start to become a bigger problem and will lead lead you to not be able to do things anymore. Like when you're 30 or 40, you won't be able to play with your kids, walk your dog, go travel the world and all of that.
Yeah.
So you want to take care of that issue right away, because I tell this to all my clients. I say, hey, you want to take care of the joint issues that you have right now, because you all you want to take care of when you're in your 30s, 40s are just the genetic diseases that your parents give you. I mean, unfortunately,
it sucks, but
it's true.
Yeah,
I mean, they're preventative measures, but yeah, unfortunately, that's the case. So take care of your body.
Yeah, take care of your body, guys. Don't be that guy. Come on, don't be that guy or gal. Just address the issue. So thank you so much for listening to this episode of Fit Facts. I really hope you enjoyed and got value. If you did, like the video, subscribe, share it with a friend. Until next time, I'm Gabe.
I'm Brandon.
Peace.
Peace.